So, as you know, the rollout of Radar Healthcare is part of our wider digital care program, and it's like a giant jigsaw, really. We've had our EMR system, our eMeds, we call it in HC1, for around 2 years now, and that was rolled out during COVID, so it was a really difficult period to roll that out, but all of our homes now are using that and have adopted that. We are now bringing the rollout of Radar Healthcare through October, November into our homes. And then the third part of that jigsaw is to roll out the electronic care planning solution, which is with another organisation called Nourish. But what we've all been working on behind the scenes, and particularly through our partnership with Radar Healthcare, is how these three systems can integrate so that our carers can have a device in their hand that not only can they work with the care plan, but they can see the medicine's history, they can work with the medicine system, but actually when they walk into somebody's room and seeing they've had a fall, for example, can record that incident through the care plan for it to go seamlessly through to Radar, and Radar does all its magic behind the scenes and then writes it back to the care plan. And that's what we're achieving, and that's what our aspiration over the next year is to make that work. And that's through the partnership approach with yourselves and other partners such as Nourish.
Yeah, and you know, interoperability, it gets bandied around quite a lot, but I mean, again, right in our early conversations, that was the heart of everything. Yeah. And if you think about it, there's so much power and value and knowledge and data that's captured within these systems, within the meds management system, within the care planning system, within Radar Healthcare. Why wouldn't you want those systems to talk to each other in an intelligent way? Because then there's two things that occur. There's the efficiencies that you just mentioned, that if I'm a carer or a home manager, that I've got access to all those systems from any point and any device. And we want that data to flow through, and as you alluded to, informing other systems to what's happening. But then the fact that you've got the data flow, and then I can at a holistic level to see what are those interactions, what do they mean? And that for me is where interoperability really comes into play, because now we're getting insights holistically, and we can collate all that data, and we do that in Radar Healthcare, and we can drive meaningful interactions and outputs from Radar Healthcare based on multiple systems.
Absolutely. I mean, just think about, we've talked about falls a number of times, but you just think about somebody who's fallen, and your carer goes into that room and will record the fall on the handheld device, and it'll go through to Radar. But actually, if we've got those data flows right, that carer will be able to see, well, actually, that person hasn't had the medication today, or they've missed the medication, they've refused the medication, or they haven't had enough to eat today, they haven't had enough to drink today, they may have an infection. All of these kind of things provide that whole picture around that resident, so we can actually then understand why he fell. And that's the power of what we're trying to do with that data flow.
And again, once you've got all that information, you've got that learning. We talk about learning management system. What does that mean? So I know the driver of HC1 is prevention.
Yes.
It's intervention. So that when we look at that resident, that those triggers and interventions are notified so that we prevent those occurrences. And I think that for me will be a great key indicator for quality, is how we drive down adverse events and incidents. Because if you think about it, if we can prevent just, X amount of falls, if you translate that down to the impact to a resident, that's a person that's had a fall and, sustained potential injury that can affect, the quality of their life from that point forward. So it's our duty of care as this partnership to drive those down. So I'm excited about that.
Absolutely.